All right. Thanks everyone for joining for today's training. What we're going to do today is we're going to go over medicare.gov. Now, this is a huge resource. I've got asked tons of questions about how am I supposed to compliantly, cross-reference different plans, compare different plans. How do I know if I'm offering my client the best plan out there? And honestly, as insurance agents, as independent agents, we have the ability to go through and represent multiple carriers. And so we got to go ahead of time knowing exactly what's going on and what's the best plan to offer our clients. So by going through medicare.gov, you can do a couple things. One, you can grab all the information ahead of time, grab your client's information, their doctors, their prescriptions, all that, and go through all of that ahead of time and come to them and present to them the best option that you feel fits their needs. Or if you're in front of them or they want to know things, particularly want to see different plans and what's available in their area, or even compare what they currently have to other plans out there, you can go to medicare.gov, and it's the only place that you can compliantly go through, cross-reference, and compare other plans. So what we're going to do is we're going to get started. This is the website through medicare.gov. And you're going to be able to, like I said, use this reference tool for you as a primary source of information. And then you as the agent, what you want to do is you want to take all the information, internalize it, kind of really dig into it, because it's very generic, meaning it doesn't always narrow down their doctors and certain things that they have going on within that they may want, certain conditions or anything like that. So you got to go through and kind of take it for what it's worth, which is a great comparison tool, and then use your expertise and your knowledge about Medicare and help guide your client to the best plan available for them. Now, what we're going to do is we're going to go through, and like I said, we're going to go into www.medicare.gov. Now, there you'll see a ton of different options up here, all around here. And so our main thing that we're going to want to do is we're going to want to go through and make sure that we know what plans and what buttons we got to push in order to get to the right place. Because like I said, there's all this information, sign up and plan changes, Medicare costs, everything right here. What we want to do is we want to go through find health and drug plans. So it's going to take you through the general search, which you're going to want to put in your zip code, because of course all these plans are designed to go off the zip code. And so you want to type in your zip code, and let's see here, and then you're going to click find plans. No, we don't want to take a survey. So this is where you can go ahead, and this is going to differ. We're going to have a couple different versions, a couple different parts to this training. But right now, we're going to do just a generic overview of all of them. But we will go back and cover out how important it is to go through and choose the right option. So first and foremost, we just want to get a generic understanding of what's out there in their market, available in their neighborhoods, where they're at in their county, and go from there. So we're going to choose original Medicare to keep it nice and simple, because if not, then we got to filter through all these questions. But let's just go with original Medicare. And we're going to talk to individuals who do not get any extra help right now. Again, there's different scenarios, and we'll go back and run through these different scenarios. But for right now, we're just going to go and say, hey, this is an individual who does not qualify for Medicaid or LIS or any other type of subsidies out there. So this is just your original Medicare plan. So we're going to continue to plan results. Okay, so this is something that's really big. That's going to be kind of it's what makes it or breaks a lot of these plans. You're going to want to know what their information is for their prescription drugs. So once you start filling out their prescription drugs, you can go in there and let's just say they've got lisinopril right there. And you start just typing it out, and it's going to go ahead and give you a drop-down menu. You pick which one it is. You pick out what their dosage is, how many they get. Do they get it every month, every 2 months? And they're going to want to ask a retail pharmacy or a mail order pharmacy. Again, there's a lot of different options out there when running these quotes and to see what's out there and available to them. But right now we're going to hold off on this for just 1 second, and we're going to circle back to this, guys, I promise. So right now we're just going to find out what plans are in their area, period. But that's what you would do is you would type in the prescription drug. Right now I'm going to go to I do not want to add drug list. No, we want to skip our drug entry right now. We just want the plans. So you'll see right here, they show 3 different options. So you can take a look at prescription drug plans with original Medicare. You can check out Medicare health plans with drug coverage, which are MAPDs, or Medicare Advantage prescription drug plans. And you can also check what's here with your Medicare health plans without drug coverage. So we don't really want to focus on that one. Hardly ever do we ever focus on that. So we just want to focus on the Medicare health plans with drug coverage. So you're going to click that right there and come over here to continue to plan results. Again, remember, if you have somebody that you're looking for a Medicare and Medicaid dual plan, then there's different options. If you want to check out chronic health plans, CSNP plans, there's different options. Right now, this is strictly for original Medicare purposes. So we're going to continue to plan results. Now, what this is going to do is it's going to bring up all of our options that we have available to us in the county, and for the zip code 85205. And as you see right here, our current plan is original Medicare. This would change if you did type in the information of a United Healthcare or Humana or Blue Cross or Aetna plan. But for right now, we just went in through and put original Medicare. And then you'll see right here, as you start scrolling down, you can see all of the different options right here, all of the different plans. So you'll see that there's 20 plans available in 85205. Now, there's only 10 of them being shown right now. So if you scroll through all of this, you'll scroll all the way down to the bottom. There's about 10 different plans, but there's 20 of them. So a lot of individuals ask, where are the other 10? You have to come up here and click on View 20, and that's where it'll show you all of your options. So we did that. We got all of our options right here. We can sort our results by different things. Do we want to know what's the lowest estimated annual health and drug cost, which is typically what we like to go off of? Overall star ratings, lowest monthly premium, the plan name, anything like that that you want to choose from this dropdown, you can. Usually I just leave it at the lowest estimated annual health and drug cost. What's their maximum out of pocket that they're going to have in just a regular, they have a generic scenario that they're going to go ahead and run. If you do choose something else, go ahead and click sort and I'll sort it for you. But we're going to keep it right here at lowest estimated annual health and drug cost. So what we're going to do is now we can see, oh, look at right here, we got the Humana Gold Plus plan. It's an HMO. It's going to give us the basic information that we're going to need. Estimated annual drug cost. How is that going to be estimated? What's going to be included in all that? They're going to go through and say, okay, here's the retail, the mail order for prescriptions, and a lot of other things. Some of the basic things that we're going to want to know are the monthly plan premiums. And this is, as you can see, there's a zero premium plan right there. You also have a drug premium that's zero and a health premium that's zero. That we'll go into show how many details will help out with LIS and other subsidies that'll actually cancel some of these premiums that your clients might have. Then it's going to say, hey, are there any drug deductibles? No. Are there any health plan drug deductibles? No. And what are their copays and tiers? So it ranges anywhere from $2 for a tier 1 up to $100 for a tier 4 and 33% probably for a tier 5. Health benefits, again, doctor's choice. The plan doctors must use plan doctors for most services. There's an out-of-pocket limit, so it will tell you $3,200 is your out-of-pocket limit. It'll give you certain things like this has limited dental, vision, and hearing. So again, this is very generic, and this is where you're going to want to jump into what you do as an agent about educating your clients and say, okay, do you want this dental, vision, hearing? Just because it says it right here does not mean it's included into the plan. It does mean that they have options available to purchase these supplemental benefits. So it doesn't mean that they're going to be included, but this plan does allow somebody to purchase a supplemental benefit package in order to receive these additional benefits. So we're going to continue going on. Drug coverage, it does tell us, if you do have put prescriptions in, it'll tell you if all of them are on there. Are there any drug restrictions? Anything like that. What's our estimated annual pocket cost? If we were to hit everything that we did, it would be about $4,040, including your health and drug. It does tell you the star ratings of a plan. And here's where some clients will have the option to go on and enroll themselves. You can completely go ahead and do that all by yourself. Your clients don't need you for this. If they do it themselves, obviously you as the agent, you don't get paid the commission, and that's what you get paid for, is to help walk them through and educate them on what their decisions are. Now, you'll see right here, this is the second one down. Okay, now we're talking this one, estimated annual health and drug costs was $40.40, and this one's $43.60. And that's, again, very generic without even putting any information in about their own personal prescriptions or their doctors and, how many times they see specialists and everything like that. So this is just kind of bare bones minimum right there. Again, it's going to walk you through the rest of the information. So you have your Humanas, your Allwell, Cignas, AARP, United Healthcare. You'll have all these plans, Blue Crosses. You'll have all these plans depending on where you're located. Will pop up, obviously, the plans that are in your area. You can do this as well for anyone, anywhere. If you have clients out of state or in different counties, then you can definitely help them out by pulling up their options. Say, hey, let's just take a look what's available in your area. So what we can do is there's a lot of things that we can do right here. This will tell us, hey, this is what's available in the area. So if we want to say, hey, let's go ahead and we can compare up to 3 plans right here. And so this is where you check this box right here. And we chose those 3 plans right there, primarily just because they're the top 3. So we can go through and check out other ones. Just click on whichever ones you want and start comparing them. Again, this is the only time that you can compare where these plans are and how they compare to each other. So it's going to give you all the basic information, what the company's name is, again, options to enroll. Remember, this is obviously it's all generic information, so it's not going to steer a client. It's non-biased. That's what I was looking for, non-biased information. It's going to give you straight facts. So it's our job to go through and really dissect the rest of the information. So again, star ratings, health plan star ratings, drug plan star ratings, any other type of information they may need about the plan. You keep scrolling down. Monthly premiums, it shows Part B is included into that. Are there any health plan premiums, drug premiums, and the estimated costs? And this will give you just generic information. Now let me go back over here for just 1 second for showing you guys this as an example. I'm going to choose this Humana plan, and I'm going to choose, let me see here. I'm going to choose this blue Medicare Advantage plan because look, it has a monthly premium involved into it. So I want to show you how and where all that comes up to play. Let me see here, and then I'll take this one. So these are the 3 plans that we're going to compare. I'm going to scroll back up over here. We're going to compare these plans. We're going to continue going just like we did before. Click into plan comparison, and this is where it'll start talking to you and telling you what's all available in this plan. Again, here's your plan premium. It's $35 for this plan. It's all put towards your prescription drug portion of it. So on top of their $134 for their Part B premium, they will have a $35 plan premium involved with it. So as you see, there's many plans that are zeros all the way across the board. This one just so happens to have a drug premium, drug plan premium involved with it because it is the Medicare Advantage prescription drug portion of it. So it may be all in one, but it does cost have additional premium involved with it on this plan. So that's why I wanted to show you where that one was. So let's go over here to what these tabs mean right here. I think some of these are pretty self-explanatory, but let's go through them. Health and drug plan benefits. So now it's going to actually walk us through what the benefits are for this plan. Again, it's going to take you through your premiums, your deductibles, your maximum out of pockets, 32, 49, 32. Okay, so let's keep going down. All right, now we're looking at 225, 285, 175. So even though this plan, let me see if I got it correctly. Yeah, even though this plan is a 0 premium for this Humana Gold plan, right here, they have a $3,200 out of pocket. They're relatively, they're the same as this plan, less than that plan. And the out-of-pocket copays for hospital stay is less than these other 2 plans. So again, this is where we can start comparing what options our clients have out there. And so you got $175 days 1 through 5. If somebody's afraid of, hey, I was in the hospital a lot last year, or I might be in the hospital a lot this next year, that right there is going to have a lower out-of-pocket days 1 through 5 versus days 1 through 7 at $225 or $285. It's going to go through outpatient hospital coverage. Again, you have your doctor's visits, and it's going to compare for a primary and specialist, primary specialist, and primary and specialist. So this is, again, coming out as a pretty darn good plan right there. Does it offer any benefits and services in addition? And how much is that? How much is the cost to add a lot of this, these additional riders? Here's some hearing benefits. You can go ahead and check out the preventive dental, the comprehensive dental, and the vision. I'm not going to get into this right this second. It'll explain some of it, and you guys can go through all of that and really find out what your clients want and if they want to add all that on. So they'll tell you what kind of supplemental packages are available. All right there. Monthly premium, $39 to add this one, $23.60 to add it onto this Humana plan. This United is $39, and Blue Cross says we don't even offer any preventive dental. We don't offer any hearing. We don't offer any comprehensive dental, and again, they do not offer additional benefits for vision. Very simple. Right here, we're going to come down. Here's the drug plan information. There's the monthly plan premium involved with these two plans right here, or excuse me, these three plans. This one does have a $35 a month plan premium. This one's zero. This one's zero. Deductible, this has a $100 deductible, $230 deductible, and zero deductible. So this is a very, very competitive plan this year, especially in Arizona. This is actually a brand new plan. So this is actually came out very, very strong. You get a zero premium plan, a low maximum out of pocket of $3,200. You have additional supplemental benefit packages that you can purchase and upgrade to, and you don't have any deductibles with your formularies, with your prescription drugs. This could completely change once we start putting in prescriptions, so we really want to know that stuff. Again, in the middle of this section right here, you'll see all the inpatient hospital coverages, doctor's visits. You can go ahead and click view more, and it'll take you through the majority, if not all, of the benefits that most people are going to really focus on. Drug costs and coverage, the next tab over. We can go through this right here. Now, of course, we didn't put anything in here, so we're not going to dive into too much detail right this second on that, but we do have drug plan information right here as well. And once we go back and do our second example, I'll show you how this is really going to play into effect on a lot of different plans and how they can go ahead and really separate themselves when they choose which prescriptions they choose to allow on their prescription formulary. Star ratings are always important. It's a good indication of what's going on with the plans. 3.5, 4, 3.5. Again, you want to really know your plans and understand what's going on and how all this could be affected in the market. Technically, these are supposed to be done on the previous year, based off of different information that they find about the doctor's performances, the member satisfaction, the ease of care, the coordinates of care, all of that stuff. It takes them a good little while. Medicare takes CMS a good little while to go ahead and compile all this information, run all these, different types of quality ratings and find exactly where they rank. And so it should be the previous year, but typically these run about 1.5 years to 2 years behind. It's kind of funky, I know, but that's just kind of how lengthy the process can be. And then right here, managed drugs. I mean, you can go back through. It's going to talk about different prescriptions that may require what's called MTM, which is step therapy, which is, step therapy is when you take a lower generic prescription cost before they allow you to take the brand name prescription, because they want to see, hey, is there a generic prescription out there that'll work just as good, if not better, than your brand name one, before the insurance company pays all that money out for all those prescription costs, and then the client may incur something if they hit the donut hole. So they really want to make sure, is there a less expensive option available for the client? Now, again, you can go back at any point in time that you want to, return to the previous page and say, you know what, I really didn't like, I really wanted to rule out this United Healthcare Plan 1, but I sure did like this Humana plan, and I did like the other plan that we were looking at, the Blue Cross, even though it had a $35 a month plan premium. We're going to check this out. Actually, I don't want to check out this HMO right here. I want to check out this one from Blue Cross Blue Shield, because now instead of $35, it's a zero premium. So again, you can go through and really start educating your clients on what their options are available and what the plan offers. Now, that was a comparison, but if you just wanted to say, oh, I just want to take a look at one particular plan, you don't need to click the little boxes right there and click compare. Just go and click on the plan itself. And that is going to just bring up just that one particular plan. As you notice, there's not 3 plans here to compare, just one plan. So if your client knows what they have or what they want, you can go straight to what that plan looks like. It's going to give you all the same information that we were looking at before. So what we're going to do is, now that we've got a good generic overview on how to get to those plans, let's start using some scenarios on where you're going to really need to dial it in and really focus on how is this going to help your client. That's the basics. That's your Medicare 101. That's all the plans available with no subsidies, no additional help, no prescriptions, no nothing. That's your bare bone minimum of where you should go when you're looking and doing your market map, and when you're going out and you're doing research on the area of what the plans are in that area, who do you need to get contracted with and everything like that. That's one of the things that you need to do, is find out what plans are in your area, who you're contracted with, who are your competing carriers with, and what carriers do you need additional contracts for. Let us know, we'll get you those contracts. So let's go back over here and let's start from the beginning. So this is going to be our scenario number 1. Go back to find health plans. Type in your zip code again, 85205 for me here in Mesa, Arizona. All right, so we're going to choose original Medicare on this option right here. And let's say we have somebody who has a, actually, let's go ahead and say we have a Medicare health plan already. We already have one, and my plan covers health and drugs. Okay, cool. Make sure that we have all of that. And let's say we do not get any help whatsoever from the government. So once you do that, it's going to come over here. You can either choose, I do not know what plan I have. If you're with your clients, you're going to know what plan they have. Just take a look at their card. And so right here, these are all the plans that are available. So let's just go through here and say we have the AARP Medicare Complete Plan 1. That's our plan. And let's just say for easy numbers, let's go ahead and throw in some prescriptions here, because we want to definitely, like I said, take a look at all this information and run a couple different scenarios. So 2 quick things. Here's something that I want you guys to this is very, very, very important. And for all of the agents who have done this before, really understand that, hey, this is something that really could save your tail end and a lot of time if you just go through and really just take this one small extra little step. And that is this right here. Okay, right here, it says retrieve my saved drug list. Your drug lists have been saved. You can retrieve your selected drugs and pharmacies on future visits using this drug list ID and password date. So this is huge. Go through, write it down, have your clients write it down, make sure you have it. So if you don't have all the prescriptions, or you need to come back for another visit, or your clients maybe add a prescription, you can go ahead and write this down, put it in their file, and keep it. So that what you want to do is you want to take down their drug list ID, which is this number right here, and the password date, which is typically today, the day that you run it. As you see, I'm doing this November 14th, 2017. And once you do that, you can go back in and type it in and find start exactly where you left off. So find exactly where you were and kind of run it through there. So I'll show you that in just another second. So we want to make sure that that is something that you do for the future, because it's definitely going to be beneficial. So let me see here. So we're going to come over here to, let's say we did lisinopril, let's say metformin. Let's say Plavix. And here's something that right here. This is where the other 2 I just kind of randomly went through. They're generic, but right here it says Plavix, and you'll see exactly what I'm talking about when we have generic and brand name prescriptions pop up. So they have right here in the system that there is a lower cost generic available for Plavix. I'm not even try to say how to pronounce that name, but that's Clopidogrel or something like that. But that is the generic name, so you can use that. But if your clients were refused the generic because they just can't use it, then you got to use the brand name one. So you got to make sure you click on that brand name and make sure everything's correct. That will play a major part on the prescription cost in the future. Let's see, hydrocodone. I have no idea what this prescription is, but I just typed it in there. It's already generic. Okay, so you can go through, add up all the prescriptions that you need to, and you can go ahead and have that. Let me see here. All right, so what I did is I put you guys on a brief hold because I wanted to grab a couple of different prescriptions just to throw it in there, see how it works out. So let's just say right here we got Chantix. Okay. And then we've got Brio. I have no idea what these prescriptions are for. I'm just throwing this as a disclaimer out there. So I'm not a doctor, so no one, judge me too much on whether these prescriptions mix or not. All right. These are just examples, everyone. So once you come over here, my drug list is completed. Click on that. Now they're going to want you to select a pharmacy. Because there's different plans that have different pharmacies, in-network pharmacies. It could be a game. It could be something that you can try figuring out. Is it lower at a CVS versus a Fry's or at a Walmart or a Walgreens, a Bashas', whatever it is, you want to see what it is. So for this conversation's sake, we'll just say, hey, we're going to go down to, we get our prescriptions at Fry's. And then you want to make sure you choose the right location and click to plan results. And there we are. We're back to the same spot where we were. We want to check out our drug plans coverage. So we want to continue on to the results. And as you noticed before, if I'm correct, I'll have to go back and double check. But if you do notice, I believe the first one was a Humana plan. Now look at it. Look at how it totally just changes the whole structure of the plans that we're looking at. So now we got Aetna. Aetna seems to be killing it with these prescription drug plans. Bright Health, Cigna. That now here's the new Humana plan that we were talking about. So they weren't anywhere near the top 5. So here we go. Let's just take a look at this plan. We got this Aetna plan, which again for our clients to say they want 0 premium. It's a great plan. It's the lowest one out of pocket. Let's take a look at that Aetna. Since they got a bunch of different plans with Aetna, that one's got a premium. We want to stay away from that one. That one's got a premium. Stay away from that one. Premium, because our client is looking for a 0 premium plan. Let's throw that Humana in there. And I think we were looking at an ARP plan earlier as well, United Healthcare. So we have our 3 plans. Let's go in and let's compare those 3. All right, here we are. AARP Medicare Complete Plan 2, Humana Gold Plus, and Aetna Prime Plan. All right, here's our basic information again. Offer all 3 as supplemental benefits to be purchased. They have a 4 out of 5 stars. You have a 3.5 and a 3.5 for overall star rating. Now these are, you get their prescription drug plans, their health plan star ratings. That means just their medical portion of it, and then you got their drug plan star ratings as well. Does tell you that they're HMOs, gives you all that basic information. Here's your Part B premiums. There's no premium because we chose all 0 premiums in there. This is going to give us, again, generic information on what we could add to it and what our maximum out-of-pockets could reach up to, our total estimated annual cost. So let's just go ahead and click on that real quick. So what is the definition of an estimated annual cost? It says when using this tool, this is an estimate of the average amount you might expect to spend each year for your health coverage. The estimates include the following: plan benefits or our coverage, costs for premiums, co-payments, deductibles, co-insurance, Costs not covered by your insurance. Your out-of-pocket costs are based on actual health coverage used by people with Medicare, and they may differ depending on your age and health status. Also, if you have a limited income and resources, your expenses may be lower. So this is just a disclaimer right down here, but that's what they're going to go off of right there. All right, so we're going to go back over here. So we know that, all that information. We know our health drug plan information now. We're going to go over it. Again, your premiums, your deductibles, are they networks? What are these maximum out of pockets? That, again, that Aetna plan is a killer plan right there, $3,000. Let's see here, 185, 175, 225. So primaries, zeros, 25, zeros and 25, 0 and 30. So they're doing really good. Again, does it offer any type of different hearing benefits, dental, comprehensive dental, excuse me, that was preventative, comprehensive dental, or vision benefits? Well, let's take a look at all of this. How can you buy it? Well, this one just so happens to have two different optional packages, package 1 and package 2. So you can go ahead and buy either one or one at $11 or another one at $21. Again, here's your monthly plan premiums and deductibles. All three of these plans have 0 premiums for their monthly plan prescription drug, and their drug deductible is 0 as well. Doesn't mean that the copays aren't, and that's where we're going to get to our drug costs and coverage. So what makes the big difference of all these plans? Why did Humana drop so much? Where did Aetna come from? Because they weren't with us before. What's going on? So let's take a look at this. Again, monthly drug premiums, plan premiums are 0, deductibles, health insurance premiums 0s, annual drug deductibles 0s. So January of enrollment. So here's an estimation of what you'll be paying. So this is how you can give a good general idea to your client of what their healthcare costs could be, including their prescription drugs. And like I said, Fry's, CVS, Walgreens, some of these pharmacies have special contracts with these providers that may make it more cost effective. So that's where you're going to want to jump in and sign, okay, is it cheaper to go with a mail order, or is it cheaper to go with, this plan, which is a Aetna plan, and make sure you get all your prescriptions at Fry's versus these two other plans. Now you could probably go back and change prescriptions if you want to change pharmacies. If you want to change pharmacies, we'll play around with it and see who's preferred pharmacy. But as of right now, we're going to run with this scenario. Looks like Aetna is beating everybody by a good portion, $2,000 to $3,000. So this is where it's going to tell you right here, out of all the prescriptions that we put down, all of those ones that we wrote down that we put in there, how is it going to affect your client? What are their copays going to be? What's going to happen? Because they have a couple of generic prescriptions in there, along with a couple of their brand name prescriptions, and those brand name prescriptions are going to cost a lot. And that's where we're going to want to find who's going to help us through the donut hole, what's going to happen at what times, what's going to go on towards our out-of-pocket costs. So let's take this one right here. This is, let me make sure I got this, United, Humana, Aetna. Okay, so on our United plan, we're going to have our co-payments for all of our prescriptions reaching $467.30 up until the 5th month. We're going to hit our donut hole, and that's where the client will take over the majority of the cost, because that's the coverage gap, the donut hole. They're going to take on the majority of that cost for the prescription, depending on if they're generic or brand name. And as you'll see, a lot of these companies, they'll offer different coverages for these prescriptions. So if they hit the donut hole or the coverage gap, what will happen is, and that coverage gap, just so everyone is reminded, if you need to, as a reminder, go back to our PDP training. But after you've reached the total cost of the drug reaches $3,750, the client will pay no more than 44% coinsurance for a generic drug, or 35% for brand name drugs. Okay. So that's where they take over, and that's why you see the bump and the increase of prescription costs all the way up until where they meet their catastrophic coverage. That catastrophic coverage hits at $5,000. At that point, their prescriptions drop down significantly, and that's where we're going to see that these two plans right here never really, well, this one in December, they hit their catastrophic coverage, but they don't really get to see the lowest portion of the catastrophic coverage. That just means that they've hit it. They'll never reach past that with the with the United Healthcare plan. And that also means that they're never going to hit that with the donut hole hitting in the 6th month for the Humana plan. But if you look over here, the prescription drug costs, you'll hit it the 5th month, and then you'll hit the catastrophic coverage the 10th month, and then November and December is going to be a significantly lower amount, because at that point, the individual only pays $3.35 for generic, or $8.35 for all other drugs. Now, remember, this, as a disclaimer, is being recorded in 2017. The coverage gap and the donut hole can be different at a different time in the next future. Please be aware of what those numbers are when you're watching these trainings. And then as you scroll down, you're going to see exactly what is it, why is it so much, what's going on. As you notice right here, how many of those prescriptions were actually covered. So 4 out of 6 of these prescriptions were covered on United, 4 out of 6 of these prescriptions were covered in Humana, and 5 out of 6 of these prescriptions were covered. So we need to go through and find out what it is. It tells us everything that we need to know. It really, really does tell us that, hey, Chantix right there, you need a prior authorization. It's a tier 4. And it's kind of weird because it's tier 3 on United Healthcare, but every company can make sure that they want to do whatever they want. So this is unique. I have no idea what this plan was. A hydrocodone something or other just so happens to be not on the formulary. Just because it's not on the formulary does not mean that your client can't have access to that prescription. It just means that they're probably going to have a prior authorization or a formulary exception. Those are 2 things that we'll go over later. But know that it is possible for your client to get those prescriptions if they've been currently taking them, especially for an extended period of time. So again, tier 1, Plavix. Wow. Plavix says you need to have step therapy. It has a quantity limit, but it is on the formulary, and that Plavix is not on the formulary for Humana or United Healthcare. So again, this is a huge benefit for you to go through and actually see. Right here, you can actually even print my drug list or print my comparison report so people can see what it is that they need to do. They can take it into their doctor and say, hey, look, I'm thinking about joining this plan. It's not on the formulary. Is there a generic drug that I could take? And instead of going to the doctor and say, hey, I need all generics, the doctors probably has them on those prescription costs for a reason. But this way you can go back and say, I'm looking at a couple different plans. I'm going to change my healthcare. Is there anything I can do to lower my out-of-pocket costs with the prescriptions, as well as continue to keep my health? That should work with you on that one. And this is, again, pharmacy information. How many pharmacies are in the zip code? Are they preferred? Are they non-preferred? What's going on? So you can definitely check all that out. If you make a mistake, you can go ahead and go through there. You can add, remove. Let's just take this one out, this hydrocodone, because it doesn't really seem to be on a lot of the formularies. And that should just change up the whole story. Look at that. That was a prescription. Now you're only hitting 64, 49, 49. I believe before it was like 109. So it changes the prescription cost quite a bit, and changes the maximum out of pocket. So now, without that one prescription, look at, you're 2,800 versus 53 and 51. So the prescriptions do matter. You're going to want to remember that. And so you're going to want to go through and you want to check all the prescriptions, the pharmacy, the mail order. How can you help your client out the best? I know it seems like a lot to begin with, and this is kind of taking a few minutes to go through all this information, but I promise you it gets easier and faster as time goes on. Star ratings, again, manage your drug costs, manage your drugs, which we already did, so we already know that. So that is a generic overview of what it is that people are available, that they're able to look at in order to start making decisions. And you can run through all this information, and you start putting all this, it starts changing all the numbers once you start adding prescriptions and pharmacies and everything like that. And so you can actually do a comparison and be educated when you go in there, and let your clients know, hey, here's some of your options. Now from here, once you've figured out what their options are, your next step is to find out what their doctors are, who are their doctors, and what plans do they accept. And then it's going to be very simple from there. If they choose all 3 plans, which is very possible, but very unlikely that all their doctors and everyone is going to be in the same network, which it is very possible. But but sometimes you have just one or two just kind of out there doctors who don't accept all plans. So that'll help narrow it down as well. So you definitely want to make sure that you want to compare everything, get a full picture of everything, and go through it and make sure that you have everything. So that was scenario number one. Let's go back to scenario number two real quick. Hang in with me. We're going to continue checking a couple of things and make sure that everything is that we're covered on all different type of scenarios that could pop up. So again, we're going to do our find our health and drug plans to, let's see here, 85205. So right here, let's just say that we have original Medicare. And now, actually, let's go ahead. Yeah, so we're going to go ahead and choose original Medicare. And if they do get extra help, you can go ahead and put what type of help you have here. So I want to go through and say, I get help from Medicaid. Okay, so now we're switching gears to a dual individual. We just look at our Medicare Advantage individuals who receive just original Medicare, or they may be on a different plan, but they do not receive any subsidies. So this one right here, we're saying, yes, we do get some type of subsidy. So we're going to continue to plan results. And this is the next step that a lot of people get confused on. Okay, so right now I don't care about prescriptions because they are typically covered the same through for a dual individual, but we do want to put them in to let us know what those are. So when we're looking for dual plans, those are HMO special needs plans, S&P plans. They're not going to pop up on these 20 plans. We got to scroll down over here to where it says select special needs plans. So you're going to click on that, and you're going to want to look for plans for people who are eligible for both Medicare and Medicaid. Now, if you wanted to do the chronic plans as well for diabetes, congestive heart failure, COPD, any other chronic needs plans or chronic special plans that are out there in your area, you can go ahead and click on that as well. And then you're going to want to come over here and update plan results. And we're going to take a look over here, 20 plans right now available. So now we got 29 because this is not going to be just the plans that we looked at, but it's also going to be the special needs plans, the dual plans for people with both Medicare and Medicaid. And so we're scrolling down and look at, here's your All-Well Dual Medicare HMO and your Mercy Care Advantage, Care First, University Care Advantage, again, your Dual Complete, all these plans. You can go through and take a look at all these plans. You've got to really understand the dual plan and how it's going to work. You got to understand that some of these out-of-pocket copays and this out-of-pocket limit right here may not even apply to them. And so you really want to make sure you know ahead of time what you're looking at and what clients qualify for these type of plans and what their out-of-pocket copays could be. So let's just say, for example, because they're on Medicare and Medicare covers 80% of a bill, Medicaid or Access covers another 20%. They typically, as long as they stay within the doctors, they really don't have any out-of-pocket copays. So if you come over here, it does say maximum out-of-pocket is $6,700, which seems like a lot. But honestly, again, if they are full dual eligible, which means they receive 100% of Medicaid, then you can go ahead and pretty much count on them. They're going to have zero out of pocket, zero copay, zero specialist. You know, that's that 20% that's being subsidized 100% through Medicaid. And so you can go ahead and check out the rest of these benefits as well. They'll always have or, meaning 0, 19, 0, 19, 0, 19. But again, if your clients are staying within the network and they're full dual eligible, have full Medicaid, then they are going to have the zero copays. So that is how you find the Medicare and Medicaid plans, the dual plans. So again, just to kind of go over a few things before we wrap it up, what we want to do is we want to make sure that we can go through and identify where these plans are located or where to find it on the medicare.gov website, which is find health and drug plans. When you go through, you want to make sure you write down the ID like we did before. And so we can go back and check at any time. You want to check the prescriptions. You want to check and see if and when they're going to hit the donut hole. Sometimes it may not even apply to them. You're going to want to go through and check the dual SNP plans if that's someone you're looking for. Make sure you have the right pharmacy, because pharmacies do matter. And typically you'll just go off of whatever pharmacy they're using right then and there. Compare plans right there. You can do that in front of a client, in front of you with your laptop. I have doing this off of my MacBook right now. You can have it there. You can send it to them in an email, do your research yourself. You can do whatever you need to do, but this is the only plan that you can do a side-by-side comparison. Now remember, you cannot walk in with a United Healthcare enrollment kit, enrollment guide, and a Humana enrollment guide and start showing them both back and forth. You can't do that. You have to educate them with this resource first, and then make a decision and go and present all the plans. And really, honestly, by then, you've gone over everything that you possibly could. By the time they reach a decision on what plan they actually want to look at, they should actually be ready to enroll as well. There really shouldn't be any more surprises that pop up when it comes to benefits, copays, and all that. If a company, and this is one thing I want to go through real quick, if a client, okay, has low income subsidy, okay, if you don't know what that is, go back to our trainings on low income subsidy. It's the same thing. It's a little bit higher of a level than Medicaid, Medicaid is a higher level, and they're just one step above that, where the individuals make a little bit too much money. You're going to want to go ahead and make sure that that you know what is going to affect this person and how are they going to pay what their prescription drug costs. So again, let me just take a look at a couple of these. Actually, I'm not going to add it. I just want to show this to you. So go back and watch our trainings on low-income subsidy, how it impacts the person, how the prescription drug plans and Social Security and extra help program actually affects these plans. Now watch that, get familiar with that. And also, this is where we're going to put into practice. So right here, let's say we went through and this plan right here has a monthly plan premium right here. If somebody receives low-income subsidy, I'm not going to get into a lot of details right now. Go back and watch our training. But if somebody has low-income subsidy or extra help from Social Security because they don't quite qualify for Medicaid, but yet they're still under probably the $1,500 mark from monthly income, they will qualify for additional help that will help them on their prescription drug costs. So it'll drop it down significantly, saving them hundreds and hundreds of dollars, sometimes thousands of dollars, and it'll drop them down from there. What could be anywhere from 30 to 90 to 31% of their prescription drug costs, down to anywhere between $3 and $8 per prescription, depending if they're generic or brand name. So if they're looking at plans, and let's just say right here, this plan right here is $35, every state has something different. So I want to let you know, as a disclaimer right now, you need to find out what that low LIS subsidy is for your state. It's just a very simple Google. You can check on some of our resources as well, but just Google, low income subsidy for Arizona or whatever state you're in. But what that's going to do is it's going to say, okay, if somebody qualifies for low income subsidy or extra help, then they receive subsidy for their prescription drug cost, their deductibles, and their drug plan costs. So in this scenario, they would have all of these co-insurances drop down to anywhere between $3 to $8. This deductible would be gone. And look at this, their $35 a month plan premium. Arizona allows a $37 a month drug plan premium subsidy. So guess what? They can actually get onto this blue Medicare Advantage Plus plan for $0. It'll completely just wipe that out, and it'll be subsidized through Social Security. Again, I want to take you into another scenario just so it clicks. This one right here, you have a $59 a month plan premium. $50 of it is drug, $8.70 of it is health. Now remember, Arizona, they only offer $37, so you're going to have the difference between $50 and $37, and on top of that, the $8.70. Let me see one more example here, just so we kind of nail it and drive it home. All right, this Humana plan right here, it has an $83 a month plan premium. It has a 0% premium for the drug plan and a $83 plan premium for the health. So again, how much will your client be paying if they're on low-income subsidy? $83. The reason why is because there is no drug plan deductible, no drug plan subsidy available. There's nothing right there. They're not charging for a premium for that. So there's nothing to wipe out, and that's health. So we don't cover health on the subsidy side on the extra help. So they would have to pay $83. Now, if they did want this plan, that's fine, but their deductible would be covered for, and so would their prescription copays and coinsurances, but their health plan would not. So that would be in addition to their $140 or whatever their Part B premium is. So I really wanted to make sure that I hit a couple of those points. I get asked these questions all the time, and it's okay to use this as an educational tool to let your clients know what's available to them and really help protect them and make them make educated decisions. But don't let this make the decisions for you. You're the expert. You're the professional. You know, once it starts getting on down, yeah, this could be a great, low cost plan. And I will throw it out right now. I would not enroll anyone on this all-well plan. I just have zero confidence in this plan as an agent. Now, other agents like it. I personally don't. It is what it is. So I haven't had a lot of great feedback from my personal clients, but it's not a one fit all plan, right? It's not a one plan fits all for everybody. So you've got to find what works, and especially if their doctors are in it and it fits their needs, and you know what, then it does. But you've got to be able to make those decisions and help educate them. You wouldn't want somebody to withhold certain information if you ask them to go to a certain restaurant and, on the outside it looks great, and your client or that person that you trust is saying, yeah, you can go to that one, but they forgot to tell you that they got food poisoning the last 14 times they went to it. So, you want to know some of that information. And so that's why you want to educate your clients as well. Use this as a resource. Use it as a guide, but don't let it determine the outcome, fully determine the outcome of what your client decides to get without educating them of all the pros and cons of the plan that you decide to represent. Once you pull out their enrollment guide, then educate them on everything you can about that plan and let them go and help enroll them. Again, we educate people. We don't sell them, just by educating them on their options, what's available to them, their cost, everything like that. That's what we're here to do. So in a nutshell, we can go on and on and on. And you can explore all over this webpage if you'd like to, different options, different plans, everything like that. That is the basics of what you need to know on how to compare plans for a client, in front of a client, if needs be. But how do you help educate your clients on what plan best fits their needs? Again, if you guys have any questions, always reach out to me or anyone here at the office and to the carriers to get more information. Appreciate you guys jumping on this WebEx. Thank you so much for your time and all your guys' effort and energy into being out there on the pavement, pounding feet on the street. I appreciate it. If you guys have any questions, let us know, and good luck.